Hello everyone, a warm welcome to our webinar today. This is Navamita Mumtaj, Head of Marketing of DPS STS School Dhaka. Thank you very much, our dear parents from DPS and ISD who have joined us today. Our session today is jointly arranged by DPS STS School and International School Dhaka in collaboration with Evercare Hospital Dhaka. Our webinar topic for today is mental boost up during COVID pandemic, the most important concern for us during this pandemic. Many of us are suffering from anxiety, insomnia, frustration, and many other psychological problems due to this prolonged lockdown state. In today's session, we are going to discuss about all these important issues. At the end of the session, we'll have a Q&A round where we'll ask questions on behalf of our parents to our speaker today. Now, I'd like to introduce our today's presenter. We have Miss Alia Firdaus Azad from Evercare Hospital today. Ms. Alia Firdaus Azad is a senior counselor in Evercare Hospital, Dhaka, specialized in psychotic, neurotic, and psychological disorders. We are very happy to have her today with us. A warm welcome to Ms. Alia Firdaus Azad. Let's start our session now. Thank you, everyone.
Thank you, Navamita. Can you please share my screen? Thank you, Navamita. Thanks for giving me this opportunity to share my topic. Good afternoon, everyone. I'm Alia Azad. I hope everyone is fine and in good health. I'm Alia Azad. I'm a clinical psychologist and presently serving in Evercare Hospital, Dhaka as a senior counselor for more than 10 years. And I have another identity also. I'm also a parent of a FS1 student of DPS school. Ayan Miras Khan is my son and I am a proud mother of him. So you can understand I'm a mother and I'm also a psychologist, counselor. So I can understand your feelings from you and your child perspective. Today, actually, our topic is mental health boost up during COVID pandemic. At first, what is COVID? We all know that COVID is a virus disease. It became pandemic because it affects throughout the world and we are facing a global crisis. And it's a new experience for us. We already know that COVID-19 is a virus disease and these symptoms are fever, cough, sore throats, headache, breathing difficulties, etc., though the symptoms are changing every day. According to World Health Organization, COVID-19 safety measures guideline is, we already know, I know, wear mask, do not touch nose and mouth, maintain social distance, at least 6 feet, hand wash properly, and clean your surroundings, etc. Mental health problem during lockdown. We are facing lots of problems actually. We all know that before getting an answer, we need to understand the question properly. So before understanding mental health boost-up technique, we need to know what kind of mental issues we are facing in this lockdown. Most of the people are facing, at first I must say, anxiety or stress or tension. The symptoms are palpitation, dry mouth, sweating, headache, vomiting tendency, etc. And if you feel vomiting tendency, You can take short meal and liquid intake can increase, because when you will try to chew, vomiting tendency will be felt again. Another symptom is stress eating. It's very common, which leads to obesity. In this crisis situation, lots of people can face this kind of symptom also. Another one is depression. Depressive symptoms are sad mood, lack of motivation, lack of energy, decrease or increase appetite. Sleep disturbance is very common, crying spell all day, etc. As we are staying at home for long time, we, the parents, can't arrange social gathering or any picnic, can't go for a long drive, can't hop on a restaurant, shopping, can't arrange dessert competition, can't celebrate national days, matching dress, hurry at morning and do regular parents gossip, which was our daily life strategy. But now all these are missing. So naturally, we can feel depressed. Another one is anger issues, anger problem. For this lockdown, people become irritated easily, and anger outbursts can happen without any reason or a small reason. Maybe someone is talking positive, but you can receive negatively as you are stressed. But it will affect our daily life, relationship, and our health, obviously. Fourth one is panic attack. Actually, panic attack, it's a psychological disorder. The symptoms are breathlessness, sweating, increased heart rate, choking sensation, numbness in body, and within 10 seconds, it will be in peak and you will feel like you are dying. As we are staying in a closed area for long time, we can face panic attack-like symptom also. The people who had mental health before, their symptoms can increase. But who are now not in who has no mental health problem, they can feel also panic attack symptom. And other one is adjustment problem. Interesting news is, I know you all know already, interesting that after lockdown in China, India, and many more countries, divorce rate is increased. That is really interesting. Not only interesting, this is remarkable also. Actually, those whose relationship was not in a tight bonding, they broke. But the relationship, whose relationship was in good position, their bonding became more tight. So to avoid adjustment problem, we should focus on positive, good attitude, positive reinforcement, positive feedback, and have to overlook advice expressed in a negative way and searching others' fault. No one likes it. What do you see? Fear of death, another one is fear of death. Actually, nowadays, fear of death, fear of isolation, loneliness, uncertainty is very common because continuously we are getting death news from different social media. We are losing our close ones. And if you become COVID positive, you need to go for isolation from your family members, which is creating loneliness. Though we know it's better, it's for betterment, still we become lonely. And fear of incapability, those are very common right now. Another one is guilt feelings. Actually, few of my patients shared that they're feeling guilty because they are thinking this pandemic started for our sin. And I think lots of people are facing this kind of negative thinking also. So need to focus on positiveness. Sleep disturbance is common nowadays. Actually, our routine became changed, especially for adolescent children. Their day become night. Lots of people are facing sleep problem, but most important thing is we are human being. We need to see color, feel sound, daylight, and people. which are available at daytime. So daytime is very much positive for mental health. So try to avoid short nap at daytime. Fixed a time for sleeping at night. Avoid strong liquor, tea, caffeine, excessive chocolate because it can hamper your sleep. Finish your exercise within daytime or 3-4 hours before your sleep. Because when you do exercise, our body temperature increases. But for better sleep, we need low body temperature. Both are contradictory. So try to finish your exercise easily. And now the main part, how we can boost up our mental health. At first, I must say, accept the situation. I know it's a new experience in our life, and we are not habituated with this lockdown. Though it's not only our problem, the whole world is facing the same. Just think, when we had no mobile in our hand, we could survive. But now, we cannot pass a day, a single day without mobile. This is a matter of habit and dependency, and it is built by practice. That means if we can accept the situation, we are 50% cured. Because after that, we will be ready to work on our habit. I know we all are in fear. Fear is okay. Because if we don't get fear, we will not maintain our safety measures. But don't be panicked. If you panic, your immune system will be weak. For fighting with COVID, we need a strong immune system, which we will get from strong mind and good lifestyle. We don't know what will happen tomorrow. If we become COVID positive, that doesn't mean end of life. Because research shows 82% COVID positive patients get cured from home, and from other 18%, 2/3 patients need not to go to ICU. They can cure from general ward. So it's a big hope for us. Another one is maintain quality time with family. We all are very busy, I know. I'm also busy. We had a common complaint. We can't give proper time to our family. Our children are growing fast and we are changing faster than them. Those who are job holder or not, everyone was busy in a horse race. But now it's a big opportunity for us to pass time with our family. So need to pass quality time with family members. Like if your son loves to play football, I will insist or I will request, participate on that. Though you don't like, but participate. Try to participate. Another one is good lifestyle. Good lifestyle means good food, proper sleep, and exercise. At first, we have to maintain good food, though we can avoid constipation and our health become more flexible. And sufficient amount of sleep help us to keep our brain calm. Exercise help us to boost up our mind. You can do 45 minutes walking in flat surface. When you do exercise, our full body's blood can circulate properly. Our brain gets sufficient amount of oxygen, which help us to reduce anxiety and depression. And it also help us to burn our calories. And we can sleep, we can get good sleep. And of course, it helps us in digestion also. Breathing relaxation. Take a deep breath. In breathing relaxation, I'll show you how you will do this. Take a deep breath by nose and hold for 5 seconds and leave by mouth. Like this. Like this. And like this, you can take 10 breaths at a time and do it 3 times in a day. You can follow. And if you do, or if you can practice, you will feel better. Obviously, you will feel better. It releases our anxiety and flexible our breathing process. And if anyone get COVID, I don't know what will happen tomorrow. If anyone, me or you, anyone get COVID, his probability of breathing related problem will be decreased, because we know one of symptom is breathing problem in COVID. Another one is meditation. There are lots of meditation technique available in YouTube. You can follow those. Meditation help us to keep our mind to be in present, which is very important right now. Because now thinking of future arises more tension. What will happen tomorrow? What will happen tomorrow? It's really tension. We are alive today. This is our gift. We are alive. Another one is ensure routine. We have to ensure maintaining our routine properly. Like food, you can take food timely, healthy, and sufficient amount. And water, 2 to 3 liter water for adult person. And of course, if you have no kidney disease or having doctor's restriction. Sleep should be 7 to 8 hours. Exercise, you can walk 45 minutes. And entertainment, enjoy at least half an hour with your favorite item. You can maintain a checklist also. And of course, focus on positive. I know lots of negative thinking will come to your mind, which we call NAT. NAT is negative, N-A-T, negative automatic thought. But we need to practice positive thinking with the help of thought challenge process. For example, what is thought challenge process? For example, if you think, what will happen tomorrow? You can challenge your thought like this: tomorrow didn't come. And if anything goes wrong, we have that strength to fight because we are human beings. We have that strength. Laughing therapy, I believe laughing therapy is priceless medicine. When someone laughs, his entire body releases positive hormone, which keep our internal organs happy and healthy. Here I will show you 2 exercises. At first, fill your cheek with air, fill your cheek with air and hold for 5 seconds and then leave it. And second one is squeeze your face, hold for 5 seconds and leave. Then try to laugh. It will help you to relax. One more thing is, when someone is in anxiety or in depressed state, his face, shoulder becomes stiff, which creates back pain, and these exercises will help in that perspective also. Maintain social interaction. Nowadays, we cannot go to our relatives' house, but we can contact them by social media as we are doing today. But our discussion topic should not be about COVID all time. We can share our positive feelings, which will help to boost up our mind. And religious activities. If you want, you can follow religious activities. And if you want, it will help you, like meditation. Discourage rumor. From different social media, we get different news, but all news are not authentic. We should avoid rumor. And according to World Health Organization guideline, you should watch COVID news only 2 times in a day, not more than that. It will give you stress. Be empathetic. We are human beings. We cannot forget our humanities. Be positive and empathetic about COVID patient. Maybe a family become COVID positive next to your door. What you will do? You will ignore them? No. You can provide facilities for them. Like you can keep a fruit basket in front of their door and ring the bell and leave the place. You don't know what will happen to you tomorrow. You will face the same attitude what you are doing today. So be positive about COVID patient because we are human being. Another one is me time. Pass at least 15 minutes with you in a day and think what kind of change you want inside your mind and behavior. And of course, practice those regularly. Participate in household activities. Now, most of the people are not allowing their helper because of safety. So all family members should share their household work so that the absence of the helper don't put burden on one person. And it will help to increase responsibility and strengthen the relationship among family members. Another one is set priority. What is our focus now? Now our focus should be how we can survive in a peaceful environment rather than focusing on others' fault. As schools are closed and only online classes are being conducted, so we have more time to put focus on our partner and children. Please don't scrutinize their fault. Appreciate their good work. Just think, they are also feeling the same as you are. Another one is our behavior need to be changed if there is any negativity. Give honor to others. Honor gives peace in our mind. If you give honor to others, it will get back same to you. We need to practice this attitude because it is positive. It helps us to keep our environment calm. Appreciate others' work. Just think, a small thanks can give you more strength to do better. If your children do something good, appreciate them. Every time you need not to give gifts, you can say a small word, good job. It will also help. We should practice this attitude. Avoid violence. This is the time to fight with COVID-19, not with our family members. We are getting lots of news of violence from different countries in social media. So if we practice positive thinking and positive attitude, we can avoid violence. And last one is, of course, self-care needs priority. Hope. Now only hope can help us to cross this crisis. My father is no more with me today in this world, but often he liked to sing a song with me. I can remember. We shall overcome one day. Maybe you all heard this song before. Now I have a strong belief that these wonderful lyrics will help us to win. Thank you all for your patience hearing. Navamita,
Yes.
achen apni?
Thank you. Yeah, sure, I'm there. Thank you very much, Miss Alia, for this wonderful session. Okay, as we said in the beginning that we will have a Q&A round for today's session. So we'll start the Q&A session now. We got some queries from our parents. I'll ask those to Miss Alia now. So the first question I got is from a parent from ISD. Her question is, now life is running so different, we have to manage everything. How to balance study life, being a mom, as sometimes I find I miss deadlines and feel anxious about not being able to prioritize self-study plan.
Thank you, Nobumita. Actually, as she's a working lady or she's doing her
Studies.
education,
Yeah.
studies, education, so I think, and she cannot adjust all this. I think at first she needs to discuss it with her family members. She at first, if she make a plan, it will not successful. Obviously, she needs help from family members. So at first, she will set her plan after discussing with family members, and of course, she needs to seek help from them. Without help,
Okay.
she cannot.
Yeah, true. So many roles altogether, right?
Exactly.
Okay.
She
Yeah.
needs, actually, she
She
seek help. She needs help.
Yeah, correct.
For
Okay.
example, I'm here. I'm
Yeah.
doing my job.
Yeah.
Without my family help, so how can?
True.
How can it be possible? You're also here. You're also
Yeah.
a woman, isn't
Mother.
it?
Yeah. Yeah.
Mother. I
Yeah.
didn't know. Congratulations.
Okay.
You're also a mother. So how you become here? Because your family members are helping you.
Exactly. True. Okay. She had another question. The question is, I have a question about behavior. Every time when parents create a routine for a child, the child has a tendency to break that. What should be done in this situation?
Childs are child. They will break it. It's common,
Mhm.
isn't it? So at
True.
first, I must say lockdown is going on. So as we are in lockdown and we are also frustrated, child's also frustrated, children's also frustrated.
True.
They can't go outside and they cannot play or go to playground. Their school is closed. Their total routine already changed. So my first request is don't push them in a race, which we do. So don't push them in a education race. Right now,
Yeah.
it's not our priority. And it's not only our problem. Whole worlds are facing this kind of problem. And of course, you will try to maintain a routine in positive way, but don't pressure them. Handle it in easy way. When everything will be fine or normal, when COVID will go and everything will be fine, we'll be in our previous life, we'll get our
Mm,
previous life, your child
right.
will be able to cope with, with the
Exactly.
help of his merit. So
Right.
believe on it, take it easy, and don't pressure.
Okay. Thank you.
Thank you.
So the next question is from a parent from DPS. Uh, how to mentally boost up the children? Many of them are upset or becoming irritated staying at homes for months.
It's very common because they are at home long time, their school is closed, and they are watching TV. Because when child is in depression, I already told the depressive symptom in my slide, but one thing is different. One thing is different between adult and child will do his favorite item, like child can watch TV whole day, but as we are adult, if we get depression, we'll not do our favorite item. There is one difference between child and adult. So as children are at home and they are passing time boring, yeah, online classes is going on, but it's not sufficient for them because they are habituated with school, which is more interactive and interesting for them. So I think parent should become a friend. They can pass quality time, I already told. And though child can share their feelings with parents easily,
Mm,
and of course, if they can share their feelings, they will start enjoy your company. So try to
right.
be friend at first. Do this. Thank
Okay.
you.
Okay. The last question is how to understand if a child is suffering from depression. How to understand that?
I already told this, discussed, but I'm again telling. In my slide, I showed that depressive symptom is, okay, let me do. Okay, depressive symptom is sad mood, crying spell, all these are depressive symptom. But only one different thing is child will do the thing he likes all day, he will do this, but adult will cut this. Only this change or only this difference. Neither every symptom are same. So if you see your child is sad, not interest with, do not share any interest with another thing, or watching all day TV or tab, and don't laugh or don't like to talk, their food decrease or increase, sleep already gone. So you will see, you will feel that maybe he is in depression. But if you have confusion, you can come for counseling. Thank you.
Okay. So thank you. Thank you very much for all the valuable inputs regarding mental boost up. So, and our Q&A round ends here. We've come to the end of our session. So Miss Alia, I'd like to request you to share some words at the end for our parents.
At first, thanks to STS, ISD, and DPS to give me this opportunity to share my experience with you. And thanks for your patience. At last, I must say, be happy and keep smiling always. Thank you.
Okay.
And thank you, Nobomita.
Thank you very much, Miss Alia. It was a very important and informative session. And thank you for conducting this wonderful session on this essential topic. It was very helpful for our parents during this, especially during this time of pandemic outbreak. I hope our parents found out a lot of important inputs today. So thanks again for attending the session today, giving us your precious time and advice. Dear parents, thank you very much for attending the session today. The session was precisely arranged for you to get valuable inputs regarding mental boost up during this time. And I hope you found it very effective and got many important insights. Thanks again to all of you. Stay home, stay safe, and stay positive.